So the patient I'm presenting today is Amy Edison. She's a 16-year-old female who was referred to us to evaluate and treat her right lower extremity and low back pain due to complex regional pain syndrome. So a month ago, she rolled her ankle during soccer practice, and then 2 days later, this progressed into extreme pain, radiating up her limb into her low back. This progression can be explained through central sensitization, which is for the following reasons. She has disproportionate pain to her injury, as in she's reporting up to 10 out of 10 pain. She has no aggravating or easing factors. She's in constant pain. She has both allodynia and hyperalgesia, which is provoked by her stress, anxiety, and fear, which I'll touch on later. And then finally, she has cyanosis and decreased skin temperature of her right lower extremity. Other conditions that she has, but we're not addressing, is her latex allergy, so we're going to make sure we use the proper gloves when working with her. But then she also has asthma, so we want to make sure that she has her inhaler nearby whenever we work with her, especially on the days that we do exercises with her. So her risk factors for central sensitization, which we're also going to treat as yellow flags, is that she has poor coping behaviors for this injury. She's non-weight bearing regardless of her weight bearing precaution. She isn't participating in bands and soccer, and also her rating of her pain, like I said earlier, is just off the charts compared to what it should be. Her pain relieving medications hasn't worked for her in the past, so she kind of has that mindset of, things haven't worked out in the past. And she also has episodic bouts of anxiety, which she reports through chest fluttering and shortness of breath. These last about seconds to minutes. And then she also was biting her nails throughout the entire history taking. She also has fear of weight bearing, so she sits down to dress. She doesn't wear any shoes or socks on that leg because it hurts so bad. And then also when she's in the shower, she doesn't let water touch her leg. I could also tell she was a little bit agitated during the history taking. Her mother was actually answering most of her questions for her, which she was irritated by with eye rolls and sighs, and so that might alert some family concerns as well. Because of her injury, she had to miss out on school, which is going to increase the stress because now she has to catch up on 14 days of work. She is experiencing pain catastrophizing. So moving forward, we're going to want to also address possible depression, which we can do through the PHQ depression scale, and then possibly refer her to counseling if needed. In terms of red flags and contraindications, I didn't see any significant red flags about her case. So nothing that would suggest contraindication to therapy or in a medical emergency. In terms of the pharmacology, she has used over-the-counter painkillers in the past, so acetaminophen and NSAIDs, but neither of these have worked, so she stopped taking them. She's also taking budesonide and formoterol, which is the first one was a steroid that she uses for asthma, and the second one is a bronchodilator. She takes those twice daily before activity, and then if she has symptom flare-ups. So some considerations for that is I looked up the side effects, and they could be causing her headaches, but we need to ask her next time about the timing of when she takes the inhaler, and then whenever her headaches come about. And also, we want to keep it nearby in case she does have a flare-up during therapy. When reviewing her labs, most of them were normal. The only one that was abnormal was her CRP levels, which is normally below 3, but hers were at 8. But this can be explained through the increased inflammation going through her system. In terms of her complete blood count, they were all normal, but some were at the upper and lower limits, but most of them had explanations. So white blood cells, most likely due to the inflammation that was in her system. So with the other ones, the main thing to consider is that we want to look at trends. If next time she gets blood work, we want to see how those numbers are trending. In terms of her imaging, the MRI shows that she has no significant impairments in her low back, hips, knees, and ankle, which would further support central sensitization, which means that her symptoms are not matching the tissue damage that she has. In terms of her personal factors, we're going to start with the negative ones. So her mental state, she's not going to have the best outlook on therapy. She's clearly anxious and fearful of that limb, and we're potentially going to have to check her for depression as well. She has a full plate of responsibilities with school, catching up to that, her sports. She's trying to rejoin soccer as soon as possible. And then she's also going through driving school right now. So she has a full plate, which is just going to add on to her stress and anxiety. And then she also had a previous injury to this right leg, which could potentially inhibit her ability to have a positive outlook on this injury. But she does have some positive personal factors, including her young age. She has no significant comorbidities, and she was previously active. So the main thing we want to consider is that we want to find motivation in these personal factors and help it. Finding that motivation will help increase the effectiveness of our treatments. In terms of contextual factors, she has a couple negative ones, including that she lives in a mobile home, which has 5 steps to enter with no rails, so that would be tough. Considering that she's currently non-weight bearing, she shares a room with her sisters, and then based on our history taking, she seems to have a little bit of a hostile relationship with her parents. But in terms of positive contextual factors, she has siblings she can use for support as well as teammates. So again, we're trying to find motivation and optimism. So hopefully finding some people that she can lean on and really support her through this, because it is going to be a long journey to get her back to where she was previously. In terms of our examination, we want to first give her an outcome measure. I recommend giving her the PHQ depression scale just to make sure to see if there is any depression involvement, and then from there refer to the correct people. After that, we want to observe the musculoskeletal system because of the mechanism of our injury. So this would include our lower quarter scan. And then in this lower quarter scan, there will be a neuroscreen, which is great. So we can always rule that out. And then finally, we'll end with some vascular tests of the extremity, just due to her complaints of coldness and cyanosis of her right lower extremity. But overall, I think her prognosis is good to return to soccer and band 6 months from now. So I feel like it's a better prognosis due to the extended timeline. So we want her to get back to soccer and band pain-free. This can be achieved through patient education and exercises with the intent to promote effective pain management strategies, decrease the fear avoidance behaviors, and to improve her overall functional mobility.